Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
Welcome to the program.
Hey.
This is Dr. Mark Vaughn. Oh, I can actually put up.
And I'm Dr. Gwen Vaughn. Look at that.
And Dr. Gwen Vaughn.
That's me.
You can see the socials there. And today we'll be talking about the movie Fairyland, a new movie. You haven't seen it.
I have not seen that.
I had the opportunity to see it. Didn't even plan on it. Just my son bought the tickets. There's a theater nearby showing it. And said, oh, I'd heard about this movie. So we watched it. Fairyland being a movie about, it's kind of a semi-autobiographical.
Yeah.
But drama made about a family in the Castro in San Francisco.
Yeah.
When AIDS hit in the 80s.
Oh, during the 80s, yeah.
And actually, the main character was I think it starts out in 1974, and she's probably around or 74 or 76. I figure she was like a year or two older than Leanne and myself.
Oh, okay.
Yeah. It follows her experience in a family when AIDS occurred.
Yeah.
So that's a medical topic, so we can talk about that. Certainly in the comments, let us know if you've watched it or if you plan on watching it or if you've heard of Fairyland. It's American Zoetrope. It's produced by Sophia and Roman Coppola. Coppola?
Sure.
Coppola?
I thought it was, sure.
That family. They're in San Francisco.
Is it going to be released broadly?
It's already out.
Okay.
Yeah, it came out this month or last month. Right. Yeah, this is November, so it came out in October. So let's go to our comments here because we can do that. We have the technology.
Look at that.
We can have this.
I was thinking about this. Yeah. With all of these newer technologies able to make AI videos, they're not going to be able to copy this because we interact with our audience. Look at that. That
would be advanced.
Yeah, that's right. This is a real deal. That's us.
You got me thinking, how can I set that up so we don't have to?
We're gonna make a video.
So Laura's saying...
It somehow responds to, I don't know how we make a live on-the-fly video that can respond to comments. Wow, that's going to be when AI takes our jobs, when that happens.
Now, I should be able to say this is Laura Barzyk or Laura Barzyk or... I always get the two mixed up. Oh, help me. What's her name? She's from the UK.
Oh, Bianca?
Bianca. I think that's Bianca. And then Laura Webb. And hasn't heard of the movie. Grateful because she doesn't like AI. Okay. Then you'll love this show.
Yeah. There's no AI here at all.
Because you won't see the AI. It's what we read to prep for the show, so you won't see it.
Yeah, that's all.
So we will
behind the scenes AI.
Well, we may be going to some. Oh yeah, we'll go to some website. I can do that now. I can show you.
What websites?
Websites. Yeah, we can use since we have the ability. We can kind of show.
I am like CDC.
For example, this is the movie. This is their Wikipedia page. There's the movie poster over on the right side, so you can see and maybe you know the actors. Or I can get it down here. We're not going to ruin the movie for you, I don't think.
Don't go down to the
the
premise, but not.
I don't think it's really going to ruin. So I don't think there's going to be spoilers. I don't think. I'm not going to say.
You're not going to get any spoilers from me.
I'm not going to say who has HIV. I'm not going to. I'm not going to say. Just stuff related to HIV infection and AIDS. That's what will be discussed in the film, not which characters have what, but just things about the disease. That's what we're talking about. To give somebody who wants to watch the movie, give them some background to what it is they're seeing on the screen, so that when they watch it, they can have the same experience I did of going, oh, I know what that is.
I know what's going on there. Yeah.
So I don't know, maybe that is a spoiler. Because most of the audience would not not
notice.
Let me also tell you about my experience of watching this movie where I did. I was in San Francisco over the weekend, and we watched this movie in the Mission, which is the district, I believe it's adjacent to the Castro. I was just
going to say that's close to
which
the
is
Castro
where the movie takes place, which is where most of the homosexual community was in the 80s, I guess still is. Also, another movie that takes place there, Milk, another San Francisco movie that takes place in the Castro quite a bit. So kind of interesting, the history in that area. So we're next to, if it's not in the district next to, it's a short walk to it. So this movie theater called the Roxy was absolutely packed for a matinee.
Wow.
And throughout the entire movie, I heard nothing. It was an absolutely silent room except for the movie. I don't experience that when there's only one other family watching the movie with us here in Auburn.
Yeah.
These people were into this movie because it was their story.
That is, yeah.
These people, I watched the movie in a theater full of people who experienced, because I saw how old the people were.
Lived it or are living in an area where it...
They were like older than me, the people watching this movie. So these were the people who lived through HIV just slamming into the Castro
during that time.
It was quiet. These people were engaged. So that was kind of an interesting experience to take in. Let's go back to our comments and see what you are saying.
What are you?
What are they saying? What are our viewers? Oh, I have to do it over here. That's right.
Grateful we're not AI.
Yeah, we're not AI.
I think that's where we left them.
For which Laura Webb is, again, I want to emphasize, she is grateful that we are not AI. Thank you, Laura. We appreciate that. Okay, so jumping back to a place to start about the film. So we're going to be talking about HIV and AIDS. I don't know that AIDS is necessarily used as a term as often as it used to be. So we throw these two terms around, and I want to give definitions.
Start there.
This is kind of like the talk I gave my kids AIDS? After we watched
the talk you gave.
So HIV is referring to the virus itself, the human immunodeficiency virus that causes AIDS. Somebody who has, and you can jump in and take over any part of this you want.
Sure.
Someone who has been infected with HIV and has that virus in them, we call them HIV positive.
Yes.
AIDS is a term that's reserved for the acquired immunodeficiency syndrome, which means
that HIV has gotten so severe it is starting to affect the immune system and drop the cells, the immune fighting cells, to a level where you are at risk for what are called opportunistic infections, or infections that come on when you're immunocompromised.
That we didn't see that much before the mid-'80s.
Right. Yeah, these were things that kind of came on and really showed themselves during that time. I learned about these in medical school, and when I came out of medical school, HIV treatment was fairly established, and with good HIV treatment, you don't see these because we can keep the HIV, the actual virus, to an undetectable level where you don't even see it when you do blood draws, and that can keep it from proliferating to the point of giving you AIDS.
Yeah. So there's a line somewhere in the movie about, there's a pharmacy technician talking about someday there'll be medicines for this. And it'll be, I'm trying to remember the words she said, but the phrase she talked about was about being able to keep it from getting bad or
Gotcha.
Yeah. She may have said cure in the movie because there was this, let's get a cure for this. We still don't have a cure.
We do not, but we're able to control it very well.
But people are able to die of natural causes now instead of dying from.
I think my earliest memory of that is Magic Johnson. I don't know if you remember that.
Oh, is he still alive?
He is still alive, and that was in the early 90s that he came out with his diagnosis, and that was a shock at that point. But I remember them saying, he was saying, and the news at that time saying, this is definitely treatable. We are now, and that was mid 90s maybe, where they had treatments available to keep 90s. it. Yeah, maybe in early 90s, but treatments available to that he was going to live, a full life and not die.
I'm trying to remember what life expectancy was before treatment.
When you had HIV? That's a good question.
I'm looking that up because I do not remember.
Yeah. So me being someone who came out of my training after HIV treatment was instituted and prolific, I have not seen many of these opportunistic affections because we treat HIV well. Early on, that treatment was difficult. And I remember people talking about having to take a handful of medications. Maybe you remember that too. Each day, every day, like you would take a handful of medications, and HIV is a retrovirus. Maybe we should talk a little bit about that and why it's so hard to treat. Because it is constantly replicating and it inserts itself. Retrovirus is like what's the word I'm looking for? Kind of copies itself into some of your cell DNA. So your cells start making it, and it's hard to get rid of it. So you'd have to take, if I remember, there was a nuclease inhibitor, protease inhibitor. Now we're getting
goes on and on.
And you had to take like
some
all
of
these
them
lists of
don't even
things.
use
And the
anymore.
reason for that was because it was so good at evading our normal treatments. We had to treat it from early on, a bunch of different ways. We were able to pare that down. But even now, they still recommend hitting it.
You still take combinations of 3 or 4.
They're all
medicines.
in one pill now, typically, but it is a combination pill to treat that. So
heavy side effects too. So,
yes, and those have gotten a little better, but they are still there. They are still there.
That hasn't come as far as long as we would have liked.
Yeah.
Okay, what I found was 8 to 10 years is expected
from diagnosis.
life expectancy of HIV when you first turn HIV positive, if you weren't treated. And now Magic Johnson has had it for 30 years.
30 years, yeah.
And that's not unusual now.
Right.
The treatments that we have, we are able to, they have to stay on the treatment, but keep the numbers down.
Yeah.
And so we also have a comment from Laura Webb saying, the last time that I went into the drive-in, the children did not stay near their parents and cars. I wasn't allowed out of the car at the drive-in. Why? Okay. I remember the early treatments being described as a cocktail. Yes.
That's a great way to describe it.
And I was just reading today about how it's recommended that you prescribe an antiemetic or a medicine that keeps you from being nauseated and throwing up with the medicines, because that is a problem.
Very common side effect. Yeah. Okay. Yeah. And the HIV doctors that I work with, I remember them saying you have to be vigilant, and they would constantly be checking, like they'd be seeing their patients, every 3 months or something, and sometimes even more often, checking these numbers, keep them down. And when they started to see that bump, they'd quickly pivot and put on a new medication to get it back down. And this would happen like multiple times over the course. And now the medications are a little better, that you can use them much more long term, but you still have to pivot every once in a while if those numbers start to increase. And
even still now, it's common for somebody who's HIV positive to have an infectious disease specialist.
Yeah, managing those medications.
Almost functioning like a primary care doctor in many cases. They'll have these practices full of people who are HIV positive and be treating not only HIV, but those infections.
They'll be screening for certain cancers that come along with it, and other things as well.
So speaking of HIV-related cancers, there are these diseases that when a person gets them and they're HIV positive, let me back up. So you can define HIV as being
don't know that
AIDS,
they have anything.
The syndrome, if they have a certain low count of the type of white blood cell that it attacks. That's one way to say, okay, you've gone from just HIV positive to AIDS. Another way is they get an AIDS-defining condition. Yeah. And one of those is a type of cancer called Kaposi sarcoma.
Yeah.
So
skin cancer.
In the movie, when you see characters with
he's black,
nasty looking, black or dark red or purplish sores on their skin, you will know, that's an AIDS-defining condition. That person's now gone from just HIV positive to AIDS. Yep. Another one is cytomegalovirus, or CMV, retinitis, infection of the retina. Now I have a little story about that.
Oh.
So if somebody's vision is going and they have HIV, the concern is that it's CMV retinitis causing it. So that plays into the movie too. So you'll be able to go, that's CMV retinitis that person's experiencing.
Right.
So I remember at John Cochran VA in the mid-90s as a medical student being told, go grab the ophthalmoscope and look at this guy's retina to see what CMV retinitis looks like. Because it was around to see back then. It's not so much now like it used to be. So this would be a good time to say, what direction has it gone? Well, the peak of HIV mortality in the United States was in the 90s. Worldwide, it was 2004, and it's gone down since then. So it's about 4,700 deaths, I think, a year in the United States.
Boy, that's still
a lot.
Yeah.
Still a lot. Not as many as other infectious diseases we talk about, like influenza.
These are deaths that are attributed to HIV and AIDS. Okay.
Yeah.
Yeah, because I was
so much improved over what it had been.
And again, with proper treatment, people are living normal lives and dying of other causes. Yeah.
Okay. Other things that you might see. Respiratory infections. So we know about
pneumonia. PCP pneumonia specifically.
PCP pneumonia, pneumocystis carinii pneumonia. Although we look today,
it was different. They changed the name.
There may be a different name.
Jarovecci,
They still refer to it as PCP, even though there's not a C in it anymore.
Not the drug PCP.
Not the drug PCP. Type of pneumonia. Then the other one is tuberculosis,
TB,
where the person commonly is coughing up blood, night sweats, losing weight. I suppose you could probably have that with PCP pneumonia too. I'm not sure. So
probably, it's a respiratory illness.
So if you see a character coughing, losing weight, having sweats, chances are that also is an AIDS-defining condition on top of the being HIV positive. Yeah. So any other comments or questions coming in? Actually, I'm surprised that we don't. Okay, let's see what kind of things we may have had reserved for us over here in the... Okay, let's look at the fast stats. I don't know if you can see that. It might be too small. We can make the numbers a little bigger there. So number of deaths, 4,700. What year is this? I think this is 2020.
Data for the 2019? That's a diagnosis.
23, there it is.
Oh, there you go, below that. Okay.
4,700, 1.4 per 100,000 people. Again, AIDS defining conditions. We talked about Kaposi sarcoma. We talked about pneumocystis carinii, except here it's called
Jarovecci.
Candidiasis or the yeast infection
of the esophagus. This isn't just like a yeast infection, like a
it's not just thrush. We're not just talking thrush here. We're talking
actually inside
painful swallowing. I've seen this too. Actually,
I've seen this too.
Back in the 90s.
I've seen this one.
Again, CMV.
I don't think I've seen it with HIV. I've seen it with other things. So I don't know why they call that because you can see that with other.
You can.
Things as well.
Fungal diseases, toxoplasmosis of the brain, or disseminated coccidiomycosis or histoplasmosis. These are things you can see in other groups. Pregnant women is histo, I believe.
Right.
But it's something that you look for with AIDS.
It's one of those that kind of piques your ears and you're like, we need to go look at
invasive cervical cancer. And then some...
PML and brain
I'm waving my finger over my brain. Encephalopathy.
They would start to have...
Central nervous system disease.
Confusion. Almost like a dementia type picture, if I remember.
I think I remember the term AIDS dementia.
That's kind of ringing a bell. I don't think I've seen that actually used in diagnoses, but I remember that term being thrown around. So what is the... I guess we talked about treatment. Right now,
Cocktails.
I mean, we're going down
3-4 drugs at a time.
It is still concern, especially in some areas, and with some more risky activities. Multiple sexual partners,
IV drug use. Where you're getting somebody else's bodily fluids
transferred. Blood. And there is treatment for that now. PrEP, which stands for pre-exposure
there's also
prophylaxis.
Post-exposure. PEP.
And PEP, which is one of those similar type of pills. I think Truvada is the one that they use.
Truvada is a PrEP, I believe.
One of the PrEP, which has a combination of those earlier medications we talked about, nucleotide inhibitors, proteases combined together. Unfortunately, with similar side effects.
Yeah, that's how it works.
You're so nauseated, you just don't want to have sex.
You don't want to be around people. So
you just like, yeah, I guess so. I guess that'd work.
We joke about it, but it's a real thing. The nausea from these medicines is significant. So it's and we our biggest exposure to post-exposure prophylaxis is when we talk in terms of needle stick clinically in a patient. Either you don't know that their HIV status, or you know that they're HIV positive,
right?
And the decision is made: do I start? Because you want to start as fast as possible. It actually matters. Hours matter with post-exposure prophylaxis. And you want to start it. You want to continue it for, I think it's 30 days, and they do some testing at that point.
Man, it's been so long since I've had to prescribe that. I don't recall.
But in people where you have the luxury of knowing that they're going to be exposed because they're choosing to have risky sexual behaviors, and so you're considering pre-exposure prophylaxis. It impacts what choices you would have for treating them if they were to actually get infected because of the problem of resistance.
Sure.
So you actually treat a person differently.
Always been the problem with
who's had prophylaxis, or meaning preventive treatment.
Yeah.
When they do catch HIV, than you would a person who didn't.
Because then you know it's gotten through that little that gate there. So yeah,
it's interesting.
Yeah.
Okay, we have a comment here from, I believe it's Robert Antonio. Let's see if I can bring up his. So in your small practice in Auburn, if you have had, we do have HIV patients, would you treat them or refer them to a specialist?
I refer to a specialist because it is a field where things are constantly changing.
It's like oncology. The medicines are always
so it is best to see an infectious disease doctor who does this all the time, who is up to date on the newest medications, and we do have them in our practice that see their specialists, and they're doing, all the ones I have are doing great and under control. Yeah. Undetectable is the term.
And certainly if we're able to monitor the T4 counts, HIV viral load, not seeing any changes, we can just keep them on those medicines. They don't have to see the
they're stable.
ID person during that stable period, which again, years.
Yep, typically.
So it takes a little bit of the load off of the ID folks,
right?
Which already such decreased numbers of transmission because people are getting down to undetectable virus counts, right? You may have heard the term undetectable equals untransmissible, and there's that's kind of what's accepted due to the studies that are coming out showing that when you can't pick up levels of the virus in their blood because they're treated so well, they're not transmitting it to their sexual partners.
Right.
Okay. Also, Robert Antonio thanking us for giving him the answer. Yeah. So let us know if you see it. Go ahead and put it in the comments of the video, and we will probably kind of close it off there because that's it. We got through what we wanted to. Tell you about an interesting movie. And thankful I was able to see it where I was with who I was able to see it. That was interesting experience.
Interesting. Yeah.
All right. Thank you, Dr. Gawain. Thank you, audience.
Yeah.
Till next time.
Hey, I'm Dr. Gawain Baugh.
Dr. Mark Vaughn telling you to stay in good health.